This short video will provide a context and framework for discussing the only approach to addressing youth mental health challenges that has any chance of substantive success. There are numerous reasons schools and communities should put youth in charge of addressing youth mental health challenges. Chief among these is research explaining why adult-led efforts often have poor results and why youth-directed efforts are more likely to be successful. All humans experience stress and anxiety when faced with a loss of power and control. When humans experience stress, their brains shift functions from the prefrontal cortex, where reasoning and rational thought are centered, to the amygdala, where emotions are centered. As children grow, their amygdala develops much sooner than the prefrontal cortex, meaning they begin with a tendency toward emotional responses even before being confronted by stress. Now, require those youth to attend school where they have little or no power or control over pretty much anything, and they begin each day stressed. Then, when a student displays signs of stress and anxiety, the adult response is often to take away even more power and control from the student, thus aggravating the situation. In extreme situations, this can spiral into full-blown crisis. Research further shows that stress interferes with learning. Thus, when students experience stress, such as from a lack of power and control, learning becomes more difficult. When students are unable to meet teacher and parent expectations for educational outcomes, and they're often told it is their responsibility or job to learn, stress levels increase, further interfering with learning and on and on. Add in countless other stressors children face, and it's no wonder many are dealing with mental health challenges. At work here is a dynamic between personal power and responsibility. No one can be responsible for something over which they don't have power, yet we are constantly made to feel we are responsible for things over which we don't have power. And we regularly make children feel this way. That sense of responsibility, absent any actual power, can be a significant source of stress. On the other hand, when given actual power, we generally welcome the corresponding responsibility that comes with it. To their credit, most schools genuinely want to help their students overcome these challenges. But for many reasons, the very attempts may exacerbate the problems, in large part because they are adult-developed and directed, and thus do not give students power and control. In other cases, schools may realize giving students voice and choice is a good strategy, but due to staffing and resource challenges faced by the schools, such efforts end up lacking integrity, and students recognize that their voices will rarely be truly heard and the choices provided are very limited. The only reasonable option remaining then is to leverage students themselves to develop and implement strategies for addressing youth mental health challenges. Providing students with power and control is a strategy for improving student mental health, but only if done with integrity. It can't be just lip service. In addition, schools and communities must be careful about the youth initially tasked with driving these efforts. The most vulnerable youth, those who are at generally the greatest risk of facing mental health challenges, have typically lost or are close to losing their trust in adults, institutions, and society in general. They are unlikely to volunteer and may be reluctant to participate if asked because they have been burned too often and have become cynical. Consequently, they must be approached by someone whom they better trust and must be given a great deal of leeway in how they participate until they begin to trust that they can be open and honest with this team that they're working with. And again, there must be integrity in the process. The adults and even other students who are less vulnerable and eager to lead must not have a hidden agenda or preconceived notions about the strategies to be used. Rather, those with the most at stake must have real opportunities to share their ideas, experiences, and feedback and must be taken seriously. The role of the adults should be that of consultants, mentors, coaches, and guides. They can serve as a moral compass of sorts. The youth, given actual power, will begin to take real responsibility, including a willingness to accept and even seek out guidance from the adults. This process will also build new resilience in the youth and help them address their own mental health challenges while building a model for helping others, other youth, as well as adults, address their challenges. There is no one model or approach to improving youth or adult mental health or addressing challenges and crises. The solutions will be unique to each individual, school, and community, which is why the individuals should be part of developing the model. That is, the youth need to be part of developing the model. They need to drive the process that will be used within their schools and communities. Thanks for watching.